The minority in Parliament is this afternoon tearing into government's plan to recruit and deploy SHS graduates to CHPS Compound across the country. The Youth Employment Agency, which is seeking to implement the project, says the SHS graduate will assist with basic healthcare delivery, such as recording medical history of patients at CHPS compounds located in rural communities. The Ghana Registered Nurses and Midwives Association have described the move as disturbing and have opposed the idea. According to member of the Health Committee, Dr. Sebastian Sandari, the program will fail and have no impact on healthcare delivery.
They don't have any space and they have no role. Bear in mind, these are people that have not finished their education. The focus should be, how do we ensure that senior high graduates, have the opportunity to continue with their education? If you train them, maybe just some few weeks or days of training, and you say they should go to CHPS zones or be at the CHPS compounds, they have no role. Even the little they learn, at a point will leave and go to school. So for how long are you going to be training? They are leaving and you are training. You do that when there's no other way of addressing the challenges. If there are no nurses, there are no community-based volunteers, then you say that, okay, we don't have the needed people. Then let's recruit anybody we can to do. But like I'm saying, you have the needed manpower, people with the skills, who rather are sitting at home, losing their skills. I mean, the nurses we have trained for years and they are sitting in the houses, they are sitting there decaying. And they have been trained, they have used years to train them. And you think that you rather train this one for some weeks or some days, they won't make any impact at the CHPS compound level. And they might bring some bad behaviors. Many are still teenagers. You get it? So why would you be exposing teenagers to all the risks and hazards at the CHPS compound?
Well, Dr. Sandari has also been taking on the defense of the Director General of the Ghana Health Service for the program.
I listened to the Director General of the Ghana Health Service in an attempt to defend this bad policy, saying that the problem of CHPS services at the community level is linkage with the community. Linkage with the community, if even is a problem, then we have to look at why it is a problem. Because the CHO has community-based volunteers, and their role is to link the community with the service delivery. Because the CHO might not come from the community, the CHO might not know all the community and the community dynamics. So you have the community health volunteers chosen by the community people themselves. So if they feel they need somebody who can read and write, it's well designed. And you have these volunteers who have been working for years, volunteering, meaning they are sacrificing. So the problem, I think, which the Director General is failing to talk about, is that these community-based volunteers at the CHPS zone level have not been motivated for years. They don't have the needed logistics to work with. No even common bicycles, no mobile phones, no motorbikes for CHOs, no fuel. These are the problems. And therefore, if there's any intervention, then see how you motivate the already existing community-based volunteers to be motivated to work.